Good morning, community. King County Medical Society and the University of Washington School of Medicine welcomes you to Continuing Medical Education, Racism in Medicine. We are honored you have joined us in this endeavor and know that this seminar is but a step along the journey to interrupt bias and eliminate health disparities. Over the next several hours, we will have a heart to heart talk where you will hear from esteemed faculty, lawyers, physicians, and surgeon experts whose collective wisdom will enrich and enlighten you to the everyday inequities faced by many patients you will encounter in your clinics and hospitals. Cultural humility begins with knowing yourself, your own background, strengths, weaknesses, and prejudices. This knowledge is extended through interactions with our communities, realizing that our professional medical community intersects with broader ethnic, racial, and religious communities. King County Medical Society, like the University of Washington, exists on Indigenous lands. We acknowledge the ancestral homelands of those who walked here before us and those who still walk here, keeping in mind the integrity of this territory where area native peoples identify as the Duwamish, Suquamish, Snoqualmie, and Puyallup, as well as the tribes of the Muckleshoot, Tulalip, and other Coast Salish peoples and their descendants. We are grateful to respectfully live and work on these lands and to follow the leadership of our community members who are Native and Indigenous, particularly those who are from these territories. This land acknowledgement is one small act in the ongoing process of working and to be in good relationship with the land and the people of the land and erase the legacy of oppression. In many cultures, the people belong to the land and not vice versa. In that spirit, we all desire the same things: family, love, and health, and our medical knowledge is but a tool to serve humanity in most restorative ways. Our introduction will feature an artist, Mr. Early Hudnall, who was born and raised in Hattiesburg, Mississippi. His sense of community within his family and that of the Black culture is what shapes his work. Mr. Hudnall began photographing while serving as a Marine in the Vietnam War, where he received a Purple Heart. He relocated to Houston to attend Texas Southern University and received his BA in art education. He is an award winning photographer, and his work is exhibited in private collections, galleries, magazines, movies, and the Smithsonian Museum of American History and the National Museum of African American History and Culture. All photos used with his permission, and he describes the images as archetypes of his life. I remember going to church and looking out over the balcony at all of the hats. This picture was taken at a funeral, and the feathers remind me of an angel's wings. Our symposium is about helping everyone live their lives to the fullest. My mission in life is not merely to survive, but to thrive, and to do so with some passion, some compassion, some humor, and some style, according to Dr. Maya Angelou. Many medical schools try and teach students to be observant by asking them to reflect on what they see. Classes in humanism and medicine may include field trips to art galleries. As our audience for the next several hours, we are asking you to do the same. Please recognize the humanity, humanness, benevolence in all of our patients. The social factors of health include neighborhood and the built environment, community, housing, food, education, and economic stability. Doctors know that they were taught in medical school about illnesses and how to treat diseases. However, most medical schools don't talk about the history of racism in medicine and why some populations suffer and die at disproportionate rates. We realize healthcare providers bring personal biases to relationships, both explicit and implicit. Statistics note all kinds of disparities, inequities, injustices, and overrepresentation concerning diseases and death. And this CME will dispel the myths of patient blaming while presenting the reason for health inequities. By the end of the day, you will be equipped to make changes in your practices. My personal story started around 30 years ago in my hometown of Houston, Texas, where I attended medical school at Baylor College of Medicine, located in the Texas Medical Center, which is the largest medical center in the world. Houston is known as a boom town of wealth, supported by innovation in energy sectors, space technology, and medicine. Interstate 45 was built through a segregated neighborhood, therefore physically separating Black people from the prosperity. Many families did not and still do not have access to adequate housing. In this photo, we notice a child doing a handstand, perhaps a metaphor for the topsy-turvy life events. This picture reminds me of me and my two sons when they were boys. A smiling mama and her two handsome sons are on their way to church on a Sunday morning. Whereas her faith is put to the test every day as she works two jobs to provide for her kids, she is grateful for every opportunity she has to spend time with them all dressed up. Every time you see a patient, please control your thoughts, alter your assumptions, and delete your biases when meeting people who do not resemble you. These boys have been lovingly nurtured, yet they are at increased risk of being harassed, arrested, jailed, or killed by the police because they, quote, fit the description, unquote, of a criminal suspect. Black people, both young and old, continue to be added to a growing list of victims with a new shooting by law enforcement reported nearly every week. This photo also represents a father as his protector, with equal pride in the United States patriotism and his beautiful daughter. This is a picture of America the Beautiful that is not usually represented in the mainstream media. Although there is other imagery in the photo besides the father, daughter, and US flag, or there are people in the background, plus the reflection of the city skyscrapers in his glasses, the daughter is the center of the father's world. What would happen to her if she were to die prematurely of a treatable illness because he did not have access to health care or his doctors dismissed his concerns and did not provide the standard treatment recommendations because the doctors were uncomfortable talking to him? Remember, the father is the center of his daughter's world, too. And grandfathers holding on to history while presenting twin values of inspiration and innovation to invigorate a common future. It truly takes a village to raise children, and all benefit from the sharing of wisdom and curiosity. His grandchildren should have the potential to fulfill his wildest dreams. Longevity of life is a gift, yet Black people die at younger ages. This picture is Juneteenth. It represents the day 2.5 years after the Emancipation Proclamation that enslaved people in Texas received word from a Union Army general that slavery had ended. This gathering represents freedom, where people play cards, dominoes, and dance. Family and friends celebrating the life and times of what binds us together as community gatherings. Communion is the lifeblood of our existence. Sharing is caring. Food is celebration. And albeit paused in the time of COVID-19, togetherness is the fabric of our lives. Pets are our best friends. They offer warmth, comfort, and security. Caring for our fur family members can help us reduce stress, anxiety, and depression, ease loneliness, encourage exercise and playfulness. Pets even can help improve our cardiovascular health, which is always at risk because everyday living is stressful. Economic, food, and housing insecurity, along with constant oppression, affect BIPOC communities disproportionately. This man is homeless, But do you think that he loves his dog any less than you love your pet? Many homeless people are veterans who have suffered trauma, have PTSD, and unfortunately have been marginalized and abandoned by society that they protected. Then they turn to substances to self medicate their invisible wounds because help is not readily available or accessible. We want our children to grow up happy, active, and secure with optimal nutrition, clean water and air, safe housing, and safe neighborhoods with transportation access to education, employment, and opportunity. Children play together naturally. Adults should strive to do the same so everyone can live their best life. As a pediatrician, I believe all children are our children, innocent in all domains. They should be cherished with access to good schools and good foods and protected by those who are sworn to protect all people. So by education and merit, in the words of Dr. Martin Luther King Jr., they will be judged by the content of their character, not the color of their skin. I wonder what this child is doing now. This photo was taken in 1991. He could be one of our colleagues right now. This child is sad and perhaps in shock. His relative is gone, but why? Could his death have been prevented by proper nutrition, screening tests, medications, or surgery? Perhaps the therapeutic relationship with a doctor might have influenced the course of his care. Because of fear of doctors and lack of trust in hospital systems, communities of color may rely at increased rate on home remedies, not wanting to incur expenses, or worry family members, or miss work, or even face microaggressions or dismissive attitudes when they present for medical care. In spite of racism implicit in the social factors of health, BIPOC are at increased risk for early and untimely death from heart disease, diabetes, cancer, and yes, COVID-19. Heart disease is the leading cause of death for all Americans. However, deaths from heart disease are higher in Black Americans than in white Americans and other ethnic groups, and heart disease develops at a younger age in Black Americans. Data from the American Heart Association states that 48% of Black women and 44% of Black men have some form of heart disease. Black adults are 60% more likely than non-Hispanic white adults to have been diagnosed with diabetes by a physician. Rates of colon cancer deaths and prostate cancer deaths are higher in Black Americans than white Americans. And during the pandemic, rates of infectivity and death with the novel coronavirus, SARS-CoV-2, is much higher in Black Americans. The CDC's COVID-19 data tracker shows that the death rates due to COVID-19 are the highest among Black and Indigenous people, followed by Pacific Islanders and Latinx people. Our program, featuring skilled, accomplished, respected, and scholarly speakers, will next provide the salient details so we will fully see our patients in all of their dimensions. And mind the physician's oath. We will not permit considerations of religion, nationality, race, party politics, or social standing intervene between our duties and our patients, and we will maintain the utmost respect for human life in service of equity. Thank you for sharing this space with us in this beautiful community.